Welcome to Quit Smoking for Your Baby, a pre-recorded webinar brought to you by Lowell General Hospital. This program is specifically designed for pregnant women and their families. This refers to both spouses and/or any parents or grandparents that may reside in or frequent the home, as well as any family or friends. We will provide you with information on the harmful effects of tobacco to the newborn and the importance of prenatal care, the dangers of secondhand smoke, the importance of having everyone in the family quit smoking, how to develop and stick to a quit plan, provide you with alternatives to deal with stress once the baby is born, and explain how to avoid relapse. And finally, we will also explain where you can find other tobacco cessation information and support programs. Expectant women are generally made aware of the dangers of smoking during pregnancy, but fewer parents are actually provided with information on the harmful effects secondhand smoke has on their babies, infants, and even all of the children in the household. And although many women quit smoking while they're pregnant, more than half of these women may fall back into the habit of smoking within 6 months after delivery. One reason pregnant women and even their partners quit smoking and remain quit-free is because they understand the dangers of smoking during pregnancy. Cigarette smoke contains more than 4,000 chemicals, and at least 60 of these are carcinogens or cancer-causing. When you smoke during pregnancy, there are toxins that get into your bloodstream, and the bloodstream is the only source of oxygen and nutrients for your baby. The two toxins that are most harmful are nicotine and carbon monoxide. In fact, studies have even shown that these two toxins cause almost every smoking-related complication that is found during pregnancy. The important thing to understand about nicotine and carbon monoxide is that they affect the loss of oxygen supply. Carbon monoxide will reduce the baby's oxygen supply and can even result in stillbirth, premature delivery, low birth weight, and other smoking-related complications. Nicotine, which is the addictive substance in cigarettes, also contributes to the loss of oxygen as well as nutrients by narrowing the blood vessels through your body, including those blood vessels that are found in the umbilical cord. In addition to the toxins that are found in cigarettes and the contribution to the loss of oxygen supply for a baby, there are many risks associated with smoking during and after pregnancy for women, their infants, and even young children. Smoking during pregnancy can cause miscarriage or stillbirth. It can lead to a premature birth or even low birth weight. For young children who have mothers who smoke during pregnancy, they can have asthma and other respiratory complications, not only as infants, but also later in life as young children. Smoking during pregnancy can affect the woman, such as cancer, heart disease, and even put her at a greater risk for stroke. The baby is at risk for birth defects and other complications. Although many pregnant women and their partners are aware of the risks associated with smoking, it still may be hard to quit. There are several addiction-related factors that play a role in the inability or the unwillingness to quit. It's a history of heavy smoking, an early age of first use, and the exposure to secondhand smoke. For the history of heavy smoking, there may be an individual who have been smoking for 10 or more years and smokes several packs, at least one pack, if not more, a day. With a history of heavy smoking, it may be hard to quit because you're so addicted to that nicotine that even weaning off of it slowly may be hard. For those who have a history of heavy smoking, we recommend that you develop a quit plan, which we will discuss later, and take baby steps. The next is an early age of first use. What this means is that many people who smoke and who are unable or unwilling to quit smoking may have been smoking since they were young, for example, as young as 12 to 16 years old. Again, when you're smoking from that long, you have a history of heavy smoking at this point, and it's a behavior that you've developed and will be hard to break. And the last is an exposure to secondhand smoke. When you're exposed to secondhand smoke, whether it be in the room with someone else or you may smell it on someone else's clothes, it brings back that reminder of the smell and the taste that you have had when you're smoking. And so that may be hard for you to quit because you may relapse as a result of that. Also, tobacco may be used as a coping method. Cigarette smoking may be used as a coping strategy or for mood control, especially among women. And interventions that are trauma-informed may have a greater potential for success because they address tobacco use as a form of self-medication. So if you find that you are someone who has turned to tobacco use as a coping method, we recommend that you enroll in an intervention program that addresses the situation as trauma-informed. And what this means is that it will also address your use of tobacco as a coping method and as a form of self-medication and help you find other ways aside from smoking to cope. Oftentimes, I'll run into a pregnant woman who's trying to quit, and rather than quit smoking, they turn to light cigarettes. However, light cigarettes are still not a healthy option. The 4 reasons that we will discuss are that the cigarette content, the changes to the design of a cigarette, adjustments to smoking light cigarettes that are made, and understanding what 100% tobacco means. So with cigarette content, although the labels on light cigarettes may say that they're low nicotine or low tar, you should realize that all cigarettes still contain roughly the same amount of nicotine or tar. Second is the changes that may occur to the design of the cigarette. Tobacco companies created light cigarettes by changing the design of the cigarettes so they produce fewer toxins when they're measured in machines. These tiny vents are placed in the filters of the cigarette so that when they're tested, the machines suck in fresh air in addition to the cigarette smoke. So when smoked by people instead of the machine, this difference disappears because what happens is that your finger actually ends up being placed over these vents. Next is the adjustment to smoking that may occur when you're smoking light cigarettes. So studies have found that individuals who smoke light cigarettes actually will puff more quickly and breathe more deeply, hoping to get that same effect. Also, you may inadvertently cover the vents in the filters, turning the light cigarette back into this regular cigarette. And again, this relates back to the design of the cigarette, where I said that the vents are placed on those filters, so the machines make it seem like you're taking in less toxins when it still is the same. And the last is to understand what 100% tobacco means. These 100% tobacco cigarettes, or these natural cigarettes, are not a safer option. Tobacco naturally contains nicotine and other toxins, and in fact, most toxins come from tobacco itself and not the additives in cigarettes. So when smoking 100% tobacco or 100% natural cigarettes, you're still getting those same toxins that are found in tobacco, making it not less safe, but still just as bad. If you have found that you have an inability or an unwillingness to quit, another question is to ask if it's possible to make it less harmful for yourself and the baby. If you continue to smoke while pregnant, smoke less. Even though just 1 to 2 cigarettes can increase the risk for complications during pregnancy, fewer cigarettes are better than smoking a whole pack each day. I also encourage you to rethink the word can't. It doesn't matter how many times you have tried to quit in the past, it still doesn't hurt to give it another shot. And studies have shown that on average, it takes a smoker 5 to 8 times to quit smoking before they're successful in quitting and remaining quit-free from cigarettes. I also encourage you to notify your doctor. If you choose to continue to smoke while pregnant, make sure you inform your doctor or obstetrician so he or she can pay close attention to the growth and development of your baby. In fact, your doctor may even be able to recommend help for quitting, such as counseling, nicotine replacement therapy, which is done under the supervision of the doctor, or other resources for quitting. Additionally, they may suggest that you take prenatal vitamin supplements. Studies have shown that pregnant women have a shortage of key nutrients such as beta-carotene, vitamin B, and even vitamin C. And by taking vitamin supplements, you would benefit from these. However, I would like to add that I recommend discussing these with the doctor before you choose to take supplements because they would be able to explain which supplements you need and what nutrients you're okay in. Several times I have mentioned the harm of secondhand smoke. So what is it? Secondhand smoke is smoke that comes from a burning cigarette, cigar, or pipe. It can make both children and adults sick. Secondhand smoke is never smooth because when you breathe it, you get the same bad air that smokers do. The smoke ends up staying in your clothes, your hair, and even on your home, such as on your furniture, in the carpets, or in the walls, even after a cigarette is out. That's why when we often explain smoking to children, we don't recommend that they ask the parent to smoke in another room, but rather outside. Because if you remain smoking in another room, the problem is that once we go into that room, the smoke is still left behind, again, on the furniture, the carpet, the walls, and even your clothes, so you're carrying it back into the room with your children and with your family with you. Realize that you cannot get rid of secondhand smoke simply by opening a window or sitting away from a smoker. And how does secondhand smoke hurt? Well, secondhand smoke, again, it's the same bad air you're getting that smokers do. So you're exposed to over 4,000 chemicals and poisons. It can cause ear infections, and studies have found that children who breathe it in are often more likely to have ear infections and ear operations at some point in their life, and it's bad for your lungs. So children and adults who breathe it are more likely to develop coughs, bronchitis, develop asthma, and pneumonia. And it can hurt pregnant women and their babies by leading to those same complications and risks that we discussed earlier, such as premature, low birth weight, and other complications later in life. Now that you have a better understanding of what secondhand smoke is, it is important to also understand how you can reduce the harm from secondhand smoke. First, choose not to smoke in your home. Also, don't permit others to do so. When you smoke in your home or you have others smoke in your home, you're being exposed to those same toxins that a smoker is exposed to. Have them smoke outside so that you're not breathing in those toxins. Also, understand that there's also a term known as third-hand smoke. So while you are next to a smoker, you're being exposed to secondhand smoke. If a smoker is in your house while smoking, they could contribute to third-hand smoke, which is the smoke that may stay behind on your furniture, on your carpets, in the walls, on the wallpaper, and other areas of your house. Next is to choose not to smoke if children are present, especially infants and toddlers. I recommend this because infants and toddlers are particularly susceptible to the effects of passive or secondhand smoke. Again, be aware of this third-hand smoke. Consider where your infant and toddlers are playing. Are they crawling on the carpet? Are they playing with toys that are in the carpet or on the same room that people are smoking? Realize that smoke does transfer from these items, and that if your child is laying on a carpet or possibly crawling on a carpet in a room that people were smoking in, they could possibly be at risk for these substances and these toxins. I also suggest that you not smoke in your car. Sometimes people will suggest rolling down their window. However, picture yourself driving, and although you think you're blowing the fumes outside or out the window, imagine that your child sitting behind you and their window is also open. So those fumes that you just flew out the window are then coming back in the car directly in your child's face. And finally, I suggest that you have a babysitter or a contractor who doesn't smoke. If you set the standard not to smoke in your home, and again, don't permit others to do so, don't make exceptions for babysitters or contractors. There are plenty of them out there, and I'm sure you could find them that doesn't smoke. In addition to the steps you can take in your home and in your car of reducing your exposure to secondhand smoke, I also encourage you to be aware of the people who smoke that you may be around. Avoid secondhand tobacco smoke as much as possible. Even if you're not the one smoking, some of the toxins will get into your bloodstream if you're inhaling secondhand or that passive smoke. The more you're around someone who's smoking, the more you're going to be absorbing of that secondhand smoke. And studies have even shown that pregnant women who are exposed to someone else's tobacco smoke will give birth to babies who weigh less than those women who aren't exposed to the secondhand smoke. So if you're making a decision to quit smoking, or maybe you're not even the one smoking and your partner is, even being around people who smoke still put you at risk for some of those pregnancy-related issues such as low birth weight or premature birth. While it's great that you desire to quit smoking for your baby, it is also important that you consider getting your partner to quit as well, if he or she is smoking as well. Living with a smoker can be hard. Secondhand smoke can be dangerous to both the mother and the baby. Breathing large amounts of this secondhand smoke can even be more harmful than smoking because the smoke from the lit end of a cigarette doesn't go through a filter. So that lit end, the end that you're breathing in from secondhand smoke, doesn't go through the same filter that a smoker breathes in. And seeing and smelling a partner smoke can actually weaken a pregnant woman's determination to quit. You also should look at ways to help your partner quit, and ways that they can help you to quit. Find out if he or she really wants to give up cigarettes, and don't be afraid to ask if they're ready to quit. Realize that you cannot force someone to stop, but that you can try to negotiate some rules. For example, explain the risk to both you and the baby if they continue to smoke while you're pregnant. Ask them to smoke outside or in a different room. However, again, remember what I said about that second and third hand smoke is that you'll still be exposed to that second and third hand smoke if they're smoking in a different room. So I really suggest that you ask them to smoke outside if they're going to continue to smoke at all. Find out if he or she even has an interest or experience in quitting, and be supportive and encourage them to set up a quit date. If you're both still smoking, this may be a great opportunity for you to quit together and provide support to each other along the way. And again, as a reminder, ask visitors to follow the same rules you set up for yourself and your partner in regard to quitting in your home and in and around it, as well as in your car and around your children. Up to this point, we've given you a basic understanding of the risks associated with smoking and exposure to secondhand smoke for both the pregnant woman and the infant child. But how does smoking really affect a baby? Let's consider 4 things: the weight and size, the body and lungs, the heart, and the brain function. So regularly smoking a pack a day can take off about a half pound from the baby's birth weight. And if you're smoking 2 packs or more, this could reduce the baby's birth weight by a pound, if not more. The low birth weight during delivery will then have a lifelong effect in the growth of the child throughout his or her life. For example, this will lead to the next discussion about lungs. So when you have low birth weight and low size, it may also lead to smaller sized babies that have underdeveloped bodies, including underdeveloped body parts, including the lung and the heart. The lungs may be not ready to work on their own, which can lead to the baby being attached to a respirator for the first several weeks of his or her life. And then your baby may continue to have breathing problems throughout their life due to the delayed development of the lungs, including being at risk for asthma. We have found that in pregnant women who give birth to their children when they were smoking, these children are at greater risk for asthma, not only when they're born because of the underdeveloped body and the greater function that the lungs need to perform at, but that we find that these children more frequently have asthma problems. This carries into when they're children, so that these are the children that frequent the emergency rooms more or the emergency departments more because they need the nebulizer treatments. That these are the ones who may be absent from school more because they have asthma. Or they may be more likely to develop bronchitis, to have colds, and even pneumonia. Again, these are all respiratory problems that could be avoided or could be reduced if they weren't exposed to smoke so young. Next is the heart. So among women who smoke during that first trimester, their baby is more likely to have a heart defect at birth. The reason being is just like how the lungs are underdeveloped, is that your heart or the baby's heart may be underdeveloped as well. And that there is a 20 to 70% higher risk for certain types of congenital heart defects compared in babies whose mothers smoked compared to those babies whose mothers did not smoke prior to their birth. In brain function, we have found that children whose mothers smoked while pregnant are more likely to have learning disorders, behavioral problems, and even lower IQs. Now that you know all of this information, why not quit cold turkey? Quitting cold turkey, although safe and one of the best things for you, it can be hard. So as soon as you quit, you'll find that there's a drastic difference in the amount of oxygen that not only the baby receives, but that even you receive. And the risk of miscarriage, premature birth, and other complications drop immediately. But quitting cold turkey can be difficult, especially if you have those risk factors of being a heavy smoker or an early age of first smoking, but it's worth the benefits for you and your baby in the long run. And while it may take your body a while to adjust to the loss of nicotine, leaving you with feelings of restlessness and irritability, it'll be worth it in the end. You may experience withdrawal symptoms, but they typically fade within the first 2 to 3 weeks, during which time the baby does not experience discomfort. So while you will begin to experience the effects immediately, your baby will also be able to experience the effects immediately because they'll receive more oxygen, but they won't experience those withdrawal symptoms that you may go through. And you also need to realize that although you may want to quit cold turkey, it may not work. And you have to look at how many cigarettes you're smoking a day and take a gradual approach to quitting. For example, if you smoke 2 packs a day, consider go down to 1 pack a day within a week or a few days, and then work your way down to a half a pack, followed by only 6 cigarettes until you get down to having 0 cigarettes a day. Whether you quit cold turkey or gradually, you're going to feel the benefits of smoking immediately. 20 minutes after smoking, your heart rate drops to a normal level. 12 hours after smoking, the carbon monoxide level in your blood drops to normal. And if you remember, this carbon monoxide level, we want it to drop to normal because high carbon monoxide will actually decrease the oxygen supply to the baby. So while you're already feeling the effects of quitting smoking 12 hours after because those carbon monoxide levels are dropping, your baby will also feel the effects 12 hours after because their oxygen supply will begin to increase. 2 weeks to 3 months after quitting, your risk of having a heart attack begins to drop and your lung functions begin to improve. You'll also see that your risk for premature labor or delivering a low birth weight baby, those risks also decrease. 1 to 9 months after quitting, your coughing and shortness of breath decrease. A year after quitting, your added risk for coronary heart disease is now half that of a smoker. So let's look even further ahead, because again, the life decisions you're making now will be ones that you can carry throughout for the rest of your life. So 5 to 15 years from now, after quitting smoking, your risk of having a stroke is reduced to that of a non-smoker. And your risk of getting cancer of the mouth, throat, or esophagus is now half that of a smoker. 10 years after quitting, your risk of dying from lung cancer is now about half that of a smoker. And your risk of getting bladder cancer is the same, about half that of a smoker. And your risk of getting cervical cancer or even cancer of the larynx, kidney, or pancreas decreases. And 15 years after smoking, your risk of coronary artery disease is now the same as that of a non-smoker. So again, whether or not you're quitting gradually or you're quitting cold turkey, you will feel the benefits of quitting smoking immediately and these lasting effects throughout your life. As I mentioned, those benefits of quitting smoking, you're going to feel the effect immediately. For you, you're going to find that you have more energy and that it's going to be easier to breathe. You're going to be able to save money so that you can use the money that you were spending on cigarettes towards other things. In fact, one analysis showed that the average cost of cigarettes in some states is as high as $11 a pack. So imagine if you put $8 to $11 aside every day or every week that you used to be buying a pack of cigarettes for, and see how fast you can save up money for items for your house, items for your family, or even put money towards long-term goals such as a vacation or a car. You will also find that your clothes, your car, and your home are going to smell better. It will reduce the stain of skin and nails and even the staining on teeth, and you'll be able to see less wrinkles. And finally, the effects for you immediately are that you're going to be able to discover that food will smell and taste better. But what about your baby? So the immediate effects is that your baby is now going to be healthier. Okay, within that 12 hours, that carbon monoxide level in your blood is going to drop, so now your baby is going to be receiving more oxygen. Quitting will let your baby be less likely to be born premature. Your baby will have more likely opportunity to come home with you rather than stay in the hospital for weeks attached to a respirator or other machines. The baby will be less likely to develop colds and ear infections. He or she will cough and cry less, and you'll find that overall they'll have fewer asthma and wheezing problems, not only as an infant but also as a child. Now that you understand the benefits to quitting and you want to quit, how do you prepare yourself to quit? When preparing to quit, ask yourself the following questions. Have you identified your reasons for wanting to quit smoking? Do you find that quitting smoking is being done for yourself? Is it done for your baby? is it done for your family? Is quitting a number one priority for you? And is quitting smoking a top health priority for you? If you don't find that quitting is a number one priority, it's going to be hard to quit. Ask yourself, have you tried to quit smoking before? If you have, what has worked in the past and what hasn't worked? And are you committed to quitting enough that it may be tough at first and it may take you several attempts before you're successful? Ask yourself if you know how to cope with withdrawal symptoms. Do you have strategies for dealing with the temptations to start smoking again, and what you would do if you're around people who are smoking? Do you have ways to handle stress without smoking? Again, some people turn to smoking and tobacco use as a coping method, but do you have other ways to cope? Do you know how to handle or how to develop social support to help you stay away from smoking? So are your friends, are your family, and are your coworkers willing to help you quit? For example, at work, I would suggest finding people who may want to walk up and down the stairs with you or around the building with you during lunch or in breaks instead of going out to smoke like you used to do. Develop new habits and develop a new lifestyle that will allow you to develop that social support to stay away from smoking. Have you planned a reward for yourself once you quit smoking? For some people, it may be that you buy yourself a new dress. And for others, who may be wanting a new car for the past several years, they wait until they become smoke-free so that when they buy that new car, you're going to maintain that new car smell for a longer time. And do you know how to manage weight gain, which can sometimes occur when people stop smoking? For example, have you found a way to exercise? Or maybe you're also going to incorporate healthier eating in terms of when you're quitting smoking. You're not going to go to the chips and the cake, but maybe you'll go to carrots and water and fruit and other vegetables. Now that you have asked yourself if you're ready to quit, it's important to develop a quit plan. I recommend that a quit plan consists of these three things, or these three questions. So identify your reasons to quit. Again, it may be for yourself, it may be for your family, or it may be because you see it as a reason to address as a health priority. Then, the second part of your quit plan should explain the family and friends that are going to be able to help you quit. It may not be a spouse, it may be a sibling, it may be a parent, it may be a friend or a coworker, but identify those individuals who are going to help you quit. And if you can, come up with a buddy system so that if you do run into times where you are challenged or you may feel like you're going to slip, have that person that you can call and talk through your urges and your cravings. And third, identify ways that you can handle slips. This is key to any quit plan because it is likely that if you do not slip, you will at least experience a craving at least once or twice. So what are the ways that you're going to handle these slips? For some, it may be going for a walk. For others, it may be finding an activity to do every time you have an urge, such as washing the dishes or folding laundry. Whatever it is, it's important that you identify these ahead of time so you can react to it appropriately and proactively. In creating a quit plan or a smoke-free plan, consider both your home and your car. In the home, try to remove any ashtrays that may be around. Post a no smoking sign on the door to explain to any family members or to any visitors that this is a no smoking zone. And make sure that you ask family and friends to respect your rules and not smoke in the home. Similarly, with the car, remove any ashtrays. Again, post that no smoking sign in the car and ask family and friends not to smoke when they're in the car with you. I would also recommend coming up with a smoke-free plan that you can address while at work. However, nowadays, especially in this area of the country, it is not possible to smoke while in work. So instead, if you are in a company that you are allowed to take smoking breaks outside, I would recommend finding other things to do while at work, such as, again, taking a walk, possibly going for water, or just sitting at your desk and maybe reading the newspaper. All of these things will help you adapt to creating a smoke-free plan and changing your lifestyle. While everybody can develop a quit plan, it's also important to understand what the keys to quitting are. The 4 keys, which we will discuss more in depth, are 1. To get ready. 2, get support and encouragement. 3, learn new skills and behaviors. And 4, be prepared to handle slips. The first key to quitting is to get ready. So think about how quitting will help you and your baby. Set a quit date and stick to it. I personally recommend quitting on a Sunday or Monday at the beginning of the week. I think a lot of times it's hard to quit on a Friday or a Saturday just because you're still not used to quitting and you may be exposed to a lot of social environments such as being out with friends and family, outside a restaurant, or even outside a bar where you may be tempted to smoke. Get rid of all the cigarettes and ashtrays in your home, car, or if you're at a workplace that still has ashtrays, try to rid yourself of those as well. And set up a smoke-free area in your home and then try to make your car smoke-free. Again, I recommend creating those no smoking signs. Though it may seem a little redundant, it will help you as a reminder for not only yourself, but also for family and friends so they know not to smoke near you and know to also give you that support while you're trying to quit. While getting ready, it is also important to plan ahead. So first, think of when and pick that quit date. I also encourage you to make it public by telling family, friends, and coworkers. If they know you're planning on quitting, but you don't tell them the quit date, it may be hard for them to support you as much as you would like. So if you let them know that, for example, on May 15th you're quitting, then by May 15th they're ready to support you, and on May 16th they'll be there for you as well. And figure out how you're going to quit. So decide if you think that quitting cold turkey will work for you, or if you will have to cut back gradually. And if you can't quit cold turkey or gradually on your own, then think about other options that are out there, such as counseling or consulting with your doctor about nicotine replacements, especially if you know neither approach is going to work of you cutting it out on your own or gradually. And then think about what. So what are you going to do to plan ahead for cravings? And what will you do if you have a craving? Maybe chew a piece of gum, or have something to eat, or take a walk to distract you. The second key to quitting is to get support and encouragement. As I mentioned, once you have a quit date, publicize it. So tell your family, your friends, and even coworkers that you're quitting, and feel free to ask them for help. In many cases, they may feel honored that you trust and value them and are looking to them for support and encouragement during this time. I also encourage you to ask smokers not to smoke when they're around you, especially at the beginning of when you're trying to quit. You may find even just being around a smoker, you can even smell it on their clothes, in their car, or even just seeing the cigarettes themselves may be a distraction for you. Talk to other women who may have quit smoking when they're pregnant. If you don't know anyone, I encourage you to possibly even look online. There's plenty of support groups out there, and there's plenty of discussion boards that you're bound to find someone who shares a similar experience to you and you can learn from. And talk to your prenatal care provider, whether or not it's your doctor or your obstetrician, to plan quit smoking and the ways they can support you. They may be able to make recommendations, and they may be able to pay special attention to your baby's growth and development. And as I mentioned earlier, they even in some cases may be able to recommend vitamin supplements that you should take as well. The third key to quitting is to learn new skills and behaviors. So try to change some of your daily habits to lower your chance of smoking. For example, some smokers tell me how every morning when they wake up, they pour themselves a cup of coffee and they go sit on their porch and they smoke. So for example, change up your routine. After you make yourself a cup of coffee before you go to work, maybe you'll now sit in front of the television and watch the news. Or if you have a paper, maybe you'll read a paper. Make sure that you're avoiding the daily habits that used to contribute to your chance of smoking. Another example here would be if you're at work. In the past, you used to take smoke breaks. Now, take walking breaks. Or find maybe other friends at work who don't smoke that you can associate with or talk to during these breaks. Another idea for learning new skills and behaviors is to plan something fun to do each day to take your mind off of smoking. This doesn't mean that you have to go to a different amusement park every day, but it does mean that you can find little things to enjoy. Maybe you're going to start learning how to run, maybe you take a yoga class, or maybe you even pick up knitting or Sudoku. Just getting things to do to take your mind off of smoking will greatly help. Practice new ways to relax. At the end of this presentation, I'll provide you with a list of resources, and one of these resources is a Freedom from Smoking class. Freedom from Smoking is offered at Lowell General, and it's a program through the American Lung Association. And one of the big components of this Freedom from Smoking program is that it does focus a lot on meditation, and it even comes with relaxation CDs and exercises to help you practice new ways to relax. So if this is not something you've done before, I encourage you to do it as well, is to find ways to meditate, or even, if you don't want to listen to something, just take 5 minutes to sit without the TV, without distractions, and really focus and relax yourself. Also, do something else when you want to smoke. Find ways to occupy your hands, your mouth, and your mind. If you're distracting your hands, you're not able to hold that cigarette. Doing something else without your mouth allows that cigarette's not in your mouth. And when your mind is on something else, your mind is not thinking about how many more minutes until you can have a cigarette again. And finally, when you're learning new skills and behaviors, it's find ways to remind yourself of your reasons to quit. If you're a pregnant woman right now, your reason to quit maybe if you're a baby, look down at your belly. Maybe post a picture of your sonogram on your fridge. The fourth and final key to quit smoking is to be prepared to handle slips. If you slip and have a cigarette, don't see this as a reason to give up. As I mentioned earlier, it can take a smoker on average 5 to 8 times to try to quit smoking before they're successful. Often I encourage people to track how often they're having a cigarette, and they'll find that the first few days, every few hours, and by maybe day 6, they're not smoking at all. But then on that seventh day, you may find that you have a cigarette for whatever reason, but don't see that as a reason to give up. Just continue to quit smoking and continue on the path that you had already started. And in fact, recognize the slip just as a mistake to be something you can learn from and not as a failure. If you do slip up, consider maybe what the triggers were. Was there someplace you were at? Was there something you were doing? Or maybe there was someone you were around. Just figure out what it was that caused that trigger and caused you to slip, and then in the future you'll find ways to avoid it. If you do slip, just set a new date and get back on track. You don't have to wait a week to stop. You can even set a new date an hour from your slip or even the next day. And even if you slip, remind yourself that by quitting, you're making a decision to protect your health and the health of your family. So just continue to remind yourself of the reasons you're quitting, and it will help you get through those tough times, those slips, those cravings, those urges. A crucial component of handling slips is to find ways to manage your stress. First, I encourage you to consider self-coaching questions. So when a stressful event occurs, stop, step back, and ask yourself some self-coaching questions to help you manage your feelings and behavior. I also recommend that you develop a series of positive self-statements. These positive self-statements will help you think more rationally and handle situations more calmly. So what are some self-coaching questions? Self-coaching questions, for example, are, what is the worst thing that could happen to me? And is my thinking helping me or hurting me? What needs to be done, and am I the one to do it? And also, how can I handle this in a way that will help, not hurt me? And what about those positive self-statements? Some positive self-statements are when you repeat over and over again things that you may find useful, such as, I can handle this, I can handle this, I can handle this. Or you breathe and you say, just take one step at a time. Relax, I can calm down with a slow, deep breath. Or say more positive statements such as, I can do it. And by saying those positive statements and coaching yourself through those difficult situations, you'll find other ways to manage stress and avoid those slips in the end. For those of you looking for more resources on quitting smoking for your baby after today's webinar, we would like to provide you with a list of several sources. The first is at Lowell General Hospital. We offer several times a year an American Lung Association Freedom from Smoking class. We also offer monthly a smoking cessation support group. In Massachusetts, the Smokers Helpline provides information and help for those who are looking to quit, and the number there is 800-TRY-TO-STOP or 800-879-8678. There are also several external resources that are not limited to, but may include smokefree.gov, quitnet.com, helppregnantsmokersquit.org, and marchofdimes.com/pregnancy. For more information on the Quit Smoking for Your Baby program, as well as other programs and classes at Lowell General Hospital, please visit www.lowellgeneral.org/health or call an advisor 24/7 at 1-877-LGH-WELL, 877-544-9355.